A 68-year-old woman walks into a clinic feeling healthy. She still shops for herself. She still cooks dinner. She still walks around the block most evenings. She is not there because something feels wrong. She is there because someone told her, "At your age, you should get checked for everything." That sentence sounds safe. But sometimes, that sentence starts a chain. One test finds a tiny shadow, another test is ordered, then a scan, then a specialist, then a biopsy, then a treatment plan. And before she knows it, she is no longer living like a healthy person. She is living like a patient, worried about something that may never have harmed her. I am Dr. George White, and I want to be very clear before we go further. I am not telling you to avoid doctors. I am not telling you to ignore symptoms. I am not telling you that medical tests are bad. Many tests save lives. But after 60, more testing does not always mean better health. Sometimes more testing means more fear, more procedures, more side effects, and more chances for something to go wrong. There is a word doctors use for this: overdiagnosis. It means finding a condition that would never have caused symptoms or shortened your life, but once it is found, it creates panic and treatment. There is another word too: overtreatment. That means treating something so aggressively that the treatment causes more harm than the problem itself. And after 60, this matters more. Your body does not recover from procedures the same way it did at 35. A biopsy can lead to bleeding. A scan can lead to a false alarm. A medication can cause dizziness or weakness. A surgery can take months to recover from. And sometimes the first test was never truly needed. So today, I want to walk you through 5 medical checkups I would question carefully after 60. Not because they are always wrong, but because you should never say yes automatically. You should know what the test can find, what happens if it finds something, and whether the next step actually protects your life. The first checkup I would question after 60 is a routine full-body cancer scan when you have no symptoms. Now, I understand why this sounds attractive. Who would not want to catch cancer early? Who would not want peace of mind? A scan that looks at the whole body sounds like powerful protection. But here is the problem. Full-body CT scans, full-body MRI scans, and broad cancer blood panels can find many things that are unclear. A tiny spot on the lung, a small cyst on the kidney, a shadow on the liver, a slight abnormal number in the blood. And once something is found, it is very hard to ignore. You may be sent for more scans, then more blood work, then a biopsy, then months of anxiety. And in many cases, the thing that was found may have been harmless, slow-growing, or not dangerous at all. Doctors call these incidental findings. They are things discovered by accident while looking for something else. Some of them matter, many do not. But once they appear on a report, they can pull you into the medical system. This is where older adults can be harmed. Some cancers grow so slowly that they may never affect a person's life. Some small abnormalities may sit quietly in the body for years without causing trouble. But if modern technology finds them, the word cancer or possible cancer can change everything. Fear takes over, and fear can push people into treatment before they understand the real risk. Now, I am not saying skip proven cancer screenings. That would be wrong. Colon cancer screening, breast cancer screening, lung cancer screening for heavy smokers, skin checks for people with high sun exposure. These can all be important when they match your age, history, and risk. What I am saying is this: be careful with one-size-fits-all full-body scans sold as peace of mind. Peace of mind can quickly become months of fear. Before you agree, ask your doctor, what are we looking for? What is the chance this finds something harmless? And if it does find something, what would we do next? That one question may save you from a long and painful cascade. Now, the second checkup I would question is routine heart stress testing when you have no symptoms. This one sounds responsible. You are over 60. You want to make sure your heart is okay. Your doctor says, let's do a stress test just to be safe. You walk on a treadmill or receive medicine that makes your heart work harder while the medical team watches the results. It sounds simple, but in people who have no chest pain, no shortness of breath during activity, no fainting, no concerning palpitations, and no clear heart symptoms, a routine stress test may not always help. The problem is false alarms. Sometimes the test suggests there may be a heart problem when there is no serious problem at all. But once the result looks abnormal, the next step may be more invasive. You may be sent for a coronary angiogram, where a thin tube is placed into an artery and guided toward the heart. That procedure can be useful when truly needed, but it is still a procedure. It carries risks such as bleeding, blood vessel injury, infection, reaction to dye, kidney strain, or abnormal heart rhythm. And sometimes the entire chain began because of a test that was not needed in a person who felt fine. Now listen carefully. If you have chest pressure, pain spreading to your arm or jaw, shortness of breath, fainting, new weakness with walking, or symptoms that appear with activity, do not ignore them. That is different. You need medical evaluation. But if you feel well and the test is being offered only because of age, ask what the test will change. Ask, "Doctor, what symptom are we investigating?" Ask, "If the result is abnormal, what is the next step?" Ask, "Would that next step help me live longer or better?" Many times, the strongest heart protection after 60 is not another test. It is knowing your blood pressure, cholesterol, blood sugar, weight, sleep quality, smoking status, and activity level. Those are the things that damage the arteries quietly. A daily walk, better blood pressure control, the right medication when needed, better sleep, less processed food, and stopping smoking can do more for your heart than a test done only to feel safe. The third checkup I would question is repeated bone density scanning too often, especially when mild findings lead too quickly to long-term medication. Bone health matters. I want that clear. Osteoporosis is real. Hip fractures can be devastating after 60. A fall can turn an independent life into surgery, rehab, a walker, and fear of moving. So I am not saying bone density scans are useless. They can be very helpful, but they should be used wisely. A DEXA scan measures bone density. It can show normal bones, osteopenia, or osteoporosis. Osteopenia means bone density is lower than ideal, but it is not always severe disease. The danger is when a mild result leads immediately to years of medication without a full discussion of real fracture risk. Some bone medications can help the right person, but they can also have side effects. With long-term use, some people may face rare but serious problems, such as unusual thigh bone fractures or jawbone issues, especially around dental work. That does not mean these medicines are bad. It means the decision should be personal. Your fracture risk is not based only on the scan. It also depends on whether you have fallen before, whether you have broken a bone before, how strong your legs are, how steady your balance is, what medicines you take, whether your vision is clear, whether your home has trip hazards, and whether you smoke or drink heavily. Now, look at what many seniors are not told. Fall prevention may protect your bones more than any scan. Strength training, balance practice, proper shoes, better lighting, removing loose rugs, installing grab bars, checking eyesight, reviewing medications that cause dizziness, getting enough protein, keeping vitamin D at a healthy level. These steps are not dramatic, but they protect real life. Because the broken hip usually starts with the fall. So if your doctor recommends a bone scan, that may be reasonable, but ask, how often do I really need this repeated? Ask, is my fracture risk high enough for medication? Ask, can we start with strength, balance, nutrition, and fall prevention? Ask, if I take medication, how long will I be on it? That is not refusing care. That is making the care fit your actual risk. The fourth checkup I would question is aggressive early Alzheimer's testing in people who have no real symptoms. This is a sensitive subject because dementia scares people deeply. Many families have watched a parent, spouse, or friend lose memory, personality, and independence, so it is understandable that someone over 60 may want to know their risk. But risk information can be heavy. Some tests look for genes linked with Alzheimer's risk. Some scans look for brain changes. Some blood tests are being developed and marketed. The science is moving quickly. But for an average person with no concerning memory symptoms, early testing can sometimes create more anxiety than benefit. Finding out that you have a higher risk does not always mean there is a clear treatment that will prevent dementia. It can lead to years of worry, fear, depression, family stress, and changes in how you see yourself. A person who was living normally may begin watching every forgotten word like a disaster. They forget where they placed their keys and think, "Is this the beginning?" They forget a name and feel fear in their chest. That kind of anxiety can steal healthy years. Now, if you or your family are noticing real changes, that is different. Getting lost in familiar places, repeating the same questions often, forgetting recent conversations, struggling with bills, personality changes, poor judgment, or memory changes that affect daily life should be discussed with a doctor. But occasional forgetfulness is not the same thing. For many people over 60, the better focus is brain protection, control blood pressure, protect hearing, treat vision problems, sleep well, stay socially connected, walk regularly, keep learning, manage diabetes, avoid smoking, limit alcohol, treat depression. These actions support brain health without creating unnecessary fear. If you have a strong family history or want genetic testing, do it with proper counseling. Do not order serious brain risk tests casually, without understanding what the results may do to your mind and your family. The fifth checkup I would question is routine PSA testing for prostate cancer in older men, especially after 75, when there are no symptoms and no high-risk history. PSA testing has been debated for years, and the reason is simple. It can find prostate cancer, but not every prostate cancer needs to be found. Many older men have slow-growing prostate cancer cells that will never cause symptoms and never shorten life. If doctors looked closely enough, many men in their 80s would have some prostate cancer present, yet most of them would never die from it. The problem begins when the test finds something slow and quiet. The word cancer changes the room. Then comes the biopsy. Then the specialist. Then radiation, surgery, or hormone therapy. For some men, treatment is necessary, but for others, especially older men with slow-growing disease, treatment may cause more harm than the cancer ever would have. Urinary leakage, sexual problems, bowel problems, fatigue, hot flashes, weakness, loss of confidence. These side effects are not small. They affect daily life, relationships, and dignity. So after 70 or 75, the PSA decision should not be automatic. If you have urinary symptoms, blood in urine, bone pain, previous prostate cancer, strong family history, or higher personal risk, talk with your doctor. Your situation may be different, but if you are older, symptom-free, and average risk, ask before the test. Ask, if this PSA is high, what would we do? Ask, would we monitor, biopsy, or treat? Ask, would treatment improve my life at my age and health status? That question matters because sometimes watching carefully is wiser than rushing into treatment. Now, let us step back. The real lesson is not that these 5 checkups are always bad. They are not. The real lesson is that after 60, every test should have a clear purpose. A good test should answer a meaningful question. It should lead to an action that improves your life. It should not simply find something that creates fear. Before any routine test, especially if you feel well, ask your doctor 5 simple questions. What are we looking for? What is the chance this test gives a false alarm? If it finds something, what happens next? What are the risks of the next step? Is there a safer or simpler option? These questions are not disrespectful. A good doctor should welcome them. You are not being difficult. You are being involved. Because your health after 60 is not measured by how many tests you get. It is measured by how well you live. Can you walk? Can you sleep? Can you think clearly? Can you stay independent? Can you enjoy your family? Can you avoid unnecessary harm? Can you make decisions without fear controlling you? That is what matters. There are still many tests I would take seriously after 60. Blood pressure checks, blood sugar and A1C, cholesterol testing, eye exams, hearing checks, dental care, skin checks if you have sun damage, kidney function, thyroid testing when symptoms suggest it. These tests often give information you can act on safely. The standard should be simple. Will this test lead to something that helps me live longer, live better, or prevent serious harm? If yes, it may be worth doing. If the answer is unclear, slow down and ask more. Do not let fear-based advertising make medical decisions for you. Do not let a wellness clinic sell you a full-body scan as peace of mind without explaining the false alarms. Do not let the word routine stop you from asking questions. Routine does not always mean harmless, and more medicine is not always better medicine. Sometimes the best medicine is the right test at the right time for the right person. So before your next checkup, write this sentence down. If this test is abnormal, what would we do differently? That one sentence can protect you from unnecessary procedures, unnecessary fear, and unnecessary loss of independence. And remember, symptoms change everything. If you have chest pain, blood in the stool, sudden weakness, sudden speech problems, unexplained weight loss, new confusion, severe pain, shortness of breath, or bleeding, get medical help. Do not use this video to delay care. But if you feel well and someone offers another routine test just because of age, you have every right to ask why. You are not just trying to stay alive. You are trying to stay well. You are trying to stay strong. You are trying to keep the life you still love. This video is for education only and does not replace personal medical advice. Your health history is unique. Always discuss screening decisions with your own doctor, especially if you have symptoms, previous abnormal results, or a strong family history.